There are many, many challenges with quality measures right now. It is very costly to obtain the data that's needed for quality measurement, or it may be costly to obtain the data that's needed for quality measurement. And the data that are used right now tend to be variable with respect to quality, so that the confidence that we can have that the measure is actually telling us what we need to know is more limited than we would like it to be because of variation in the quality of the input data. There are problems with risk adjustment, that when you're making statements about the quality of different providers or different health plans, and the outcomes of care depend not only on the quality but depend on what the patient brings to the encounter. The potential to confuse differences in quality with differences in risk is high, and the techniques that we have for risk adjustment are somewhat limited. There are problems with statistical power, that many of the things that we want to know don't happen frequently, fortunately, and so the ability to sort of make statistically meaningful judgments about quality is limited, and this is a challenge that's very hard to solve. I think one of the big problems right now is that the measures tend to be what others have called lamppost measures. We tend to measure the things that we can measure. We tend to measure the things that are easier to measure, which aren't always the things that are most important to know. I think, how do we solve those? Some of it will happen as electronic infrastructure begins to or more fully permeates the healthcare system. I think a very important part of the solution is to bring the patient's voice to the measurement process through reaching out to the patient and not only collecting data about patient experience through patient surveys, but collecting data about symptoms or the way patients experience their life, which is, at the end of the day, what the healthcare system really should be working to improve.